What are the risk factors for hypertension? High blood pressure has many risk factors, including 1. Age. The risk of high blood pressure increases as you age. Until about age 64, high blood pressure is more common in men. Women are more likely to develop high blood pressure after age 65. 2. Race. High blood pressure is particularly common among people of African heritage. It develops at an earlier age than it does in whites. Serious complications, such as stroke, heart attack and kidney failure, are also more common in people of African heritage. 3. Family history. High blood pressure tends to run in families. 4. Being overweight or obese. The more you weigh, the more blood you need to supply oxygen and nutrients to your tissues. As the amount of blood flow through your blood vessels increases, so does the pressure on your artery walls. 5. Not being physically active. People who are inactive tend to have higher heart rates. The higher your heart rate is, the harder your heart must work with each contraction and stronger the force on your arteries. Lack of physical activity also increases the risk of being overweight. 6. Using tobacco. Smoking or chewing tobacco immediately raise your blood pressure temporarily. The chemicals in tobacco can damage the lining of your artery walls. This can cause your arteries to narrow and increase your risk of heart disease. Secondhand smoke also can increase your heart disease risk. 7. Too much salt, sodium, in your diet. Too much sodium in your diet can cause your body to retain fluid, which increases blood pressure. 8. Too little potassium in your diet. Potassium helps balance the amount of sodium in your cells. A proper balance of potassium is critical for good heart health. If you don't get enough potassium in your diet, or lose too much potassium due to dehydration etc., sodium can build up in your blood. 9. Drinking too much alcohol. Over time, heavy drinking can damage your heart. Having more than 1 drink a day for women and more than 2 drinks a day for men may affect your blood pressure. If you drink alcohol, do so in moderation. For healthy adults, that means up to 1 drink a day for women and 2 drinks a day for men. 1 drink equals 12 ounces of beer, 5 ounces of wine or 1.5 ounces of 80 proof liquor. 10. Stress. High levels of stress can lead to a temporary increase in blood pressure. Stress-related habits such as eating more, using tobacco or drinking alcohol can lead to further increase in blood pressure. 10. Certain chronic conditions. Certain chronic conditions also may increase your risk of high blood pressure, including kidney disease, diabetes and sleep apnea. About 6 out of 10 of people who have diabetes also have high blood pressure. Diabetes causes sugars to build up in the blood and also increases the risk for heart disease. 11. Sometimes pregnancy contributes to high blood pressure as well. Although high blood pressure is most common in adults, children may be at risk, too. For some children, high blood pressure is caused by problems with the kidneys or heart. But for a growing number of kids, unhealthy diet and lack of exercise contribute to high blood pressure. Complications of hypertension. Excessive pressure on your artery walls caused by high blood pressure can damage blood vessels as well as your organs. The higher your blood pressure and the longer it goes uncontrolled, the greater the damage. Uncontrolled high blood pressure can lead to complications including 1. Heart attack or stroke. High blood pressure can cause hardening and thickening of the arteries, atherosclerosis. It can lead to a heart attack, stroke or other complications. 2. Aneurysm. Increased blood pressure can cause your blood vessels to weaken and bulge, forming an aneurysm. If an aneurysm ruptures, it can be life-threatening. 3. Heart failure. To pump blood against the higher pressure in your vessels, the heart has to work harder. This causes the walls of the heart's pumping chamber to thicken, left ventricular hypertrophy. Eventually, the thickened muscle may have a hard time pumping enough blood to meet your body's needs. It can lead to heart failure. 4. Weakened and narrowed blood vessels in your kidneys. This can prevent these organs from functioning normally. 5. Thickened, narrowed or torn blood vessels in the eyes. This can result in vision loss. 6. Metabolic syndrome. This syndrome is a group of disorders of your body's metabolism. They include increased waist size, high triglycerides, decreased high-density lipoprotein, HDL, cholesterol, the good cholesterol, high blood pressure and high insulin levels. These conditions make you more likely to develop diabetes, heart disease and stroke. 7. Trouble with memory or understanding. Uncontrolled high blood pressure may also affect your ability to think, remember and learn. Understanding concepts. Trouble with memory or understanding concepts is more common in people with high blood pressure. 8. Dementia. Narrowed or blocked arteries can limit blood flow to the brain. It leads to a certain type of dementia, vascular dementia. A stroke that interrupts blood flow to the brain also can cause vascular dementia. How is high blood pressure treated? Doctors have a wide range of high blood pressure medicines available to treat high blood pressure. These high blood pressure treatments include diuretics, often called water pills, beta blockers, calcium channel blockers, angiotensin-converting enzyme, ACE, inhibitors, angiotensin II receptor blockers, ARB, and other types of medication. As effective as these drugs can be at controlling blood pressure, you may have to take them for the rest of your life. That is one more good reason to focus on prevention. How do blood pressure medicines work? Blood pressure medicines can work several different ways. Blood pressure medicines can keep blood pressure at a healthy level by 1. Causing your body to get rid of water, which decreases the amount of water and salt in your body to a healthy level. 2. Relaxing your blood vessels. 3. Making your heart beat with less force. 4. Blocking nerve activity that can restrict your blood vessels. Talk with your healthcare team about the best type of treatment for you. You may need to take more than one type of medicine to control your blood pressure. It is important to take your blood pressure medicine exactly as your doctor tells you to. Do not stop taking your current medicine without talking to your doctor first. Stopping your blood pressure medicine without first talking to your doctor could lead to serious health consequences. What are the benefits and risks of blood pressure medicines? The benefits of blood pressure medicines are clear. Blood pressure medicines can help you keep your blood pressure at healthy levels. Therefore, they greatly reduce your risk of heart disease, heart attack, and stroke. In general, the risks of taking blood pressure medicines are low. However, all medicines have risks. Talk with your doctor about the risks of high blood pressure medicines. What are the side effects of blood pressure medicines? Most of the time, blood pressure medicines do not cause side effects. Some people have mild side effects, including dizziness, headaches, swelling in the legs or feet, or stomach problems. Over-the-counter medicines, such as nasal decongestants, can also raise blood pressure and interact with blood pressure medicines. Tell your doctor about any medicines or supplements you are already taking. All medicines have side effects. Talk with your doctor about the best blood pressure medicines for you, their benefits, risks, and side effects. How do I know if I need medicine for high blood pressure? Your doctor will tell if you need medicine for hypertension, based on your blood pressure readings over a period of time. If you use a home blood pressure monitor, record or write down your readings. Share your readings with your doctor so that he can make the best decision to manage your blood pressure. What are other ways you can lower blood pressure? In addition to taking medicine to control your blood pressure, take other steps to keep your blood pressure levels healthy. Get regular physical activity. Staying physically active is one of the best things you can do for your health. Physical activity helps keep your heart and blood vessels strong. It also can help you keep a healthy weight. Do not smoke. Smoking damages your blood vessels. Smoking greatly increases your risk of not only high blood pressure but also heart disease, heart attack, and stroke. Eat healthy foods. Choosing healthy meal and snack options can help you avoid high blood pressure and its complications. Be sure to eat plenty of fresh fruits and vegetables. Keep a healthy weight. Having overweight or obesity means your heart must work harder to pump blood and oxygen around the body. Staying at a healthy weight reduces the stress on your heart and reduces your risk for heart disease, heart attack, and stroke. Treatments include lifestyle changes, and if that's not enough, may also include medications. Lifestyle changes include cutting back on sodium. Ask your doctor what your daily sodium limit should be. Read the nutrition facts label on food products. Getting more exercise. Studies show benefits with 3 to 4 sessions per week, each lasting 40 minutes, of aerobic exercise. Losing weight. If you're overweight, you can expect to shave about 1 point off your blood pressure numbers for each pound lost. Eat a healthy diet. The DASH diet is designed to improve blood pressure. DASH for hypertension. DASH stands for Dietary Approaches to Stop Hypertension. It favors vegetables, fruits, whole grains, low-fat dairy, poultry, fish, and chicken. Limiting alcohol to no more than 1 drink a day for women or 2 for men. If you also need medication to lower your blood pressure, there are several types. Diuretics, ACE inhibitors, alpha blockers, angiotensin II receptor blockers, ARBs. Beta blockers, calcium channel blockers, central agonists, vasodilators. Combination medications. If you need medication, your doctor will consider which type is best for you. Medications for controlling hypertension. Conventional drugs for treating high blood pressure include 1. Angiotensin-converting enzyme inhibitors. Angiotensin-converting enzyme, ACE, inhibitors block the actions of some hormones. These hormones regulate blood pressure, such as angiotensin II. Angiotensin II causes the arteries to constrict and increases blood volume, resulting in increased blood pressure. ACE inhibitors can reduce the blood supply to the kidneys, making them less effective. As a result, it is necessary for people taking ACE inhibitors to have regular blood tests. People should not use ACE inhibitors if they are pregnant, have a condition that affects the blood supply to the kidneys. ACE inhibitors may cause the following side effects, which usually resolve after a few days: dizziness, fatigue, weakness, headaches, a persistent dry cough. If the side effects are persistent, doctor may prescribe an angiotensin II receptor antagonist instead. These alternative medications often cause fewer side effects. They may include dizziness, headaches, and increased potassium levels in the blood. 2. Calcium channel blockers. Calcium channel blockers, CCBs, aim to decrease calcium levels in the blood vessels. This will relax the vascular smooth muscle, causing the muscle to contract less forcefully, the arteries to widen, and blood pressure to go down. CCBs may not always be suitable for people with a history of heart disease, liver disease, or circulation issues. A doctor can advise on taking CCBs and which type of CCB is safe to use. The following side effects may occur, but they usually resolve after a few days. Side effects: redness of the skin, headaches, swollen ankles and feet, dizziness, fatigue, skin rash, swollen abdomen, in rare cases. 3. Thiazide diuretics. Thiazide diuretics help the kidneys get rid of sodium and water. This lowers blood volume and pressure. The following side effects can occur, and some of them may persist. Low blood potassium, which can affect heart and kidney function, impaired glucose tolerance, erectile dysfunction. People taking thiazide diuretics should have regular blood and urine tests to monitor their blood sugar and potassium levels. 4. Beta blockers. Beta blockers were once popular for treating hypertension, but doctors tend to prescribe them now only when other treatments have not been successful. Beta blockers slow the heart rate and reduce the force of the heartbeat, causing a drop in blood pressure. Side effects may include fatigue, cold hands and feet, slow heartbeat, nausea, diarrhea. Less common side effects are disturbed sleep, nightmares, erectile dysfunction. Beta blockers are often the standard medication for a person with very high blood pressure, known as a hypertensive crisis. 5. Renin inhibitors. Aliskiren, Tecturna, Razels, reduces the production of renin, an enzyme that the kidneys produce. Renin helps produce a hormone that narrows blood vessels and raises blood pressure. Reducing this hormone causes the blood vessels to widen and blood pressure to fall. This drug is relatively new, and healthcare professionals are still determining its optimal use and dosage. Possible side effects include diarrhea, dizziness, flu-like symptoms, fatigue, and cough. Additional tests for hypertension, urine and blood tests. These can check for underlying problems, such as a urine infection or kidney damage. Exercise stress test. This will measure a person's blood pressure before, during, and after using a stationary bicycle or a treadmill. Electrocardiogram, ECG. An ECG tests electrical activity in the heart. For a person with hypertension and high cholesterol levels, a doctor may order an ECG as a baseline for comparing future results. Changes in future results might show that coronary artery disease is developing or that the heart wall is thickening. Holter monitoring. For 24 hours, the individual carries an ECG portable device that connects to their chest through electrodes. This device can provide an overview of blood pressure throughout the day and show how it changes as the level of activity varies. Echocardiogram. Ultrasound waves show the heart in motion. The doctor will be able to detect problems such as thickening of the heart wall, defective heart valves, blood clots, and excessive fluid around the heart.